we've bought ourselves a lot of time now to be able to deal with, educating the masses about the importance of distancing and wearing masks. So the lockdown is an extreme procedure, but let us just say, for argument's sake, that you've been able to get everyone to practice physical distancing, to be able to wear masks, have some amount of, reduction of transmission. That's what really helps in the long term. Lockdowns are very inefficient ways of achieving this end, because lockdowns are sharp, and then when the lockdown ends, if you go back to behaving just like you did at the beginning of the lockdown, you've bought yourself time, but you've not bought yourself anything with respect to lives, because the reproductive number, the disease goes back to exactly where it was before. So my hope is that as we go forward, we can change one major thing, which is that we remove this destigmatization of COVID. It's difficult. We want to get people to take COVID seriously, but you don't want to take them seriously in a way which they think that anyone with a COVID infection should just be shunned and should be cast out of society. And that's sort of what's happening now, which is, in the process of trying to get people to take it seriously, we've sort of reached another end, which is also not desirable, because now very few COVID patients who think they have the disease are going to show up at a health center to be tested, because they associate COVID with stigma, both within their communities, with their families, and everyone else. There are examples of people, for whom there's no one to do their last rites, or to bury them, or to cremate them, because of the stigma of association with COVID. So we've got to reset
like the early
somewhat.
days of AIDS.
Exactly. We're exactly in that same situation where you want to communicate that this is important for a public health perspective, but you don't want to make it such that people move into a space of stigma, in which case your testing goes down, people don't actually show up, and you're not able to test and contain people. You're exactly right. It is like the early days of AIDS.